Well, research shows that complicated pregnancies have risen in recent years, and the stress of this challenging time can be harmful not only to moms but also their babies' early physical and mental development. And with Mother's Day and Mental Health Awareness Month happening in the month of May, one local doctor is shedding light on the stress that a complicated pregnancy can escalate to and what can be done about it. Joining us now is Dr. Daneshmand of Scripps Clinic here in San Diego. Dr. D, as he goes by as well. Welcome, sir.
Thank you for having me, Jim.
So first, let's find out a little bit about you and your expertise. What drew you to this line of your medical profession?
Oh, my goodness. Well, it's just, I always wanted to be a surgeon, to be honest with you. And I took a few rotations in obstetrics, and I fell in love with it. I actually was given a talk at Rady Children's on Saturday to high school and middle school students who are interested in going into healthcare. And I said, follow your passion. A lot of times you may want something, but once you actually start doing the work, you may be drawn to something that is actually moving you. So obstetrics was the specialty that I was drawn to, and then high-risk obstetrics because it's always different. There's always something exciting, and you're dealing with wonderful families during very difficult times.
Well, we're very glad to have you here today, and we're talking about the issue of complicated pregnancies and that they've been increasing of late. What is the reason for that? What's going on?
Thank you, Jim. Yeah, there was a recent Blue Cross Blue Shield study from 2014 to 2018 and showed, looking at 1.8 million pregnancies, that pregnancy and childbirth complications are on the rise by approximately 17%. And what has given a rise to this is, unfortunately, chronic health conditions, such as we've seen a rise in diabetes, we've seen a rise in chronic hypertension, and obesity, and also depression and anxiety have been on the rise. So you take these comorbidities, and unfortunately, they increase your risk during pregnancy, such as hypertensive-related crises, or preeclampsia, as many people know it, or toxemia. Increase the risk for gestational diabetes mellitus. And again, if you have a complicated pregnancy, remember, every mother, every parent wishes for a healthy child, for a healthy pregnancy. And so when you have a complicated pregnancy, that could certainly add to the stress and anxiety for that mom and that family.
And when we talk about avoiding a complicated pregnancy, from what you described, it sounds like something before you get pregnant, if you can, and if you're planning, there are some things you can do to take care of yourself so you're better prepared to become pregnant.
You're absolutely right, Jim. Thank you for mentioning that. So the time that we can actually intervene and make a difference is really in the preconception period, where you can actually address, both the medical, the surgical, the family history, the medications that moms may be on before they get pregnant. So, what Scripps started the perinatology program, or the high-risk pregnancy program, in August of 2018. That's when we joined with now 5 other colleagues, and soon to have a 7th colleague joining us. And it was basically to address this unfortunately increased rise in pregnancy-related and childbirth complications. And again, one of the areas that we focused on at Scripps is access, but also how do we deliver the best care to these women going through difficult pregnancies.
And on that subject, you've written about that in terms of making sure that hospitals are as prepared as they can be for these complicated pregnancies. Expound on that a little bit.
So not only did Scripps invest in, obviously, an expensive program, which is bringing high-risk pregnancy specialists in and creating a whole team, but they recognize also that it's important for a high-risk mom to have someone who they can talk to, they can get information from. So Scripps invested in a complex care coordinator, as you know, or a patient navigator, as many people know, that are common in oncology and transplant divisions. But in high-risk pregnancies, we don't necessarily see a whole lot of patient navigators. So a patient who, for example, sees me and has, for example, a baby with congenital abnormality, let's say a heart defect or a spine defect, this mom now can be scheduled for a consult with a patient navigator or a complex care coordinator. And this individual now is basically walking this family through the journey of this complicated pregnancy, making sure that all their appointments are set up, making sure that they're seeing the specialists that they need to see, getting the MRIs or the echocardiograms, for example, that are ordered. And also remember, Jim, when a mom has a child that's sick, or a mom is going through a difficult time, it's, between appointments, that's also a very stressful time. They come into the office, I give them bad news, they go home, they talk to the family, they go online. Now, this investment from Scripps, which I'm very excited about, to be honest with you, is now allowing for also frequent screenings for mental health, anxiety, depression. And once we identify these patients as having a high risk or in that category of feeling more stressed and anxious and depressed, now Scripps has also collaborated, which is what I love, their collaborative approach with a local nonprofit to address mental health. For these complicated pregnancies, again, the fundamental issue that we're trying to solve is how do we get these moms immediate access to a professional who can address their needs. And so we're planning on doing this, on launching the program on May 16th, and again, seeing these moms as early as 72 hours after their diagnosis.
We have been talking with Dr. Sean Daneshmand with the Scripps Clinic. Dr. D, thank you so much for your time and your insights on this.
Thank you so much, Jim. Thank you.